Let's go to our program. I'm pleased to welcome Benji Wagner, trial lawyer at Habush and Rotarians, to introduce our speaker, Dr. Shekar Kurpad. Benji.
Thank you very much. Good afternoon. Today I have the honor and privilege to introduce my good friend, Dr. Shekar Kurpad. And his professional biography is full of brilliance and tremendous accomplishments, and I'm going to try to stay compliant with my 2-minute window here. So of note, Dr. Kurpad is the current chair of neurosurgery at MCW. He is co-director of the Center for Neurotrauma Research at MCW, and he is the director of the Neuroscience Line and Spinal Cord Injury Center at MCW Freighter. And most recently, and of most note today, he was selected as the founding director of the Wisconsin Institute of Neuroscience, and the shorthand for that is WINS, which is a partnership between the Medical College of Wisconsin, Freighter, the VA, and Children's Hospital of Wisconsin. And the purpose of this WINS Institute is to create a world-class clinical care destination, unique clinical trials, groundbreaking research, and innovative education for all things neuroscience, which include movement disorders, mental health, spinal cord and traumatic brain injury, etc. Dr. Kurpad's vision to build an internationally renowned institution has become a reality. And he's here to share and educate us about what we're going to be seeing in the upcoming weeks, months, and years here in our region. In particular, we will learn about the Avalon Action Alliance, which is a foundation that one of the creators of Home Depot, a man named Bernie Marcus, created for the benefit of veterans and healthcare and first responders to treat trauma and mental health. And they chose to invest in WINS. It's now my honor and privilege to introduce Dr. Kurpad, and for those of you in medicine, you hear about what's called the triple threat, which is a doctor who can do his own or her own primary research, who trains and educates medical students, and also provides high-quality clinical care, which he continues to do by performing neurosurgery. He's more than a triple threat. I would say he's a quadruple threat because number 4, he just happens to be a wonderful human being. So, Dr. Kurpad, welcome to Milwaukee Rotary.
It's hard to follow an introduction like that. It's a little bit intimidating to be introduced in such a kind way. Thank you very much, Benji. I must say it's a real honor to be invited to speak in front of this audience. People here come from all walks of life, extremely accomplished. And really, I want to thank the Rotary Club for inviting me, Ben Wagner especially, for making this happen. So thank you very much for that. I'm hoping today to sort of share some of my thoughts. I really am here representing 4 institutions: Freighter Health, Children's Wisconsin, the VA, and the Medical College of Wisconsin, about the Neurosciences Institute effort that we launched last year. So it's about a year and 3 months in the making, and why we believe it's important to invest in the neurosciences, why it's important for our community, and why we think that we are able to be in a position to go to national leadership, not only serve a regional area, all of Wisconsin, the Midwest, but also nationally. So why should we invest in the neurosciences? Why are neurosciences important? So here's a snapshot. So if you look at Alzheimer's disease, the disease burden is quite significant nationally, and it's a point of conversation both nationally as well as in Wisconsin. Same thing goes with movement disorders, symbolized by Parkinson's disease. Stroke, a very common entity, very disabling entity, affects the ability of people to lead their normal lives, interferes with a person's life, their family, and their job, etc., and causes a significant amount of disability. I'd venture to say that in this room, everyone probably knows or has been in contact with a friend or a family member that suffers from one of these three conditions. Now, you add to this the concept of neurotrauma, which I'm going to talk about in a little bit, as well as other diseases of the nervous system, like memory disorder, like movement disorder, like stroke and multiple sclerosis. Really, it's quite universal in how much it affects our community at large. So with that, I want to introduce WINS. So WINS is a concept that we came up with jointly at our four institutions, created a symbol and a logo that really incorporates all of neurosciences and the partnership in a connected way with the four institutions that are contributing to it. Why is this particular name important? Essentially, it's important for patients because we feel that it enables easy recognition of an entity that serves patients with neurological problems in Wisconsin, regionally, as well as nationally. No neurological institute is complete without the right type of people working in it. It's critical to attract the best talent, not only from the region, but also from the rest of the country to come to Milwaukee and work so that the delivery of neuroscience care is better for people here as well as people at large. So it's about the people, the place that is best, where we can recruit the best and the brightest recruits and trainees. The presence, in terms of regional and statewide presence from inception, it represents partnerships, talking about the Rotary, a win-win situation for the four partner organizations as well as for our community at large. And then for philanthropy, effectively represents a unifying name and theme to attract widespread philanthropy, part of which is the Avalon Action Alliance, which I'm going to share with you in some more detail than has already been presented. Why is it possible in Milwaukee? We have neuroscience institutes in Chicago and New York, other places in the country. Why is it important? Why is it possible in Milwaukee? We feel like we have key strengths. We feel like we have the resources at Froedtert Health, at Children's Wisconsin, at the Medical College of Wisconsin, key resources that are required to advance the neurosciences. And then we also feel like it's a four-way opportunity for our stakeholders, all our stakeholder organizations. And then you all, the level of community engagement in this effort is extremely high. And because neuroscience is such a personal thing for a lot of people in the community, we think it's really possible to establish something like this in Milwaukee. How do we do it? It's a big idea. We started on it about a year ago. Do we really think we can accomplish it? Do we have a track record of doing something of this nature? How do we do it? So one example of that is neurotrauma. We've talked about traumatic brain injury and spinal cord injury. And here's the numbers nationally as well as statewide for neurotrauma. Who's at risk for neurotrauma? Who's at risk for traumatic brain injury and spinal cord injury? Well, if you drive a car, you're at a risk for having a bad head injury or a spinal cord injury. If you climb a ladder, if you're doing an errand around the house, you're at risk for traumatic brain injury and spinal cord injury. So really, every one of us in this room and our families, our family members and friends are at risk for TBI and spinal cord injury. It's a very common problem, like the other pillars of neurosciences. So at Froedtert and the Medical College, we've really invested and grown neurotrauma and demonstrated a path to national success. We currently, happily, are ranked number 5 in the country in neurotrauma, and that encompasses research, clinical trials, which is a way of getting advanced new care for patients with brain and spinal cord injury, in terms of our clinical care, in terms of the educational opportunities we offer so we can train the next generation. How did we do it? We made a key recruitment several years ago, and that key recruitment is Dr. Michael McRae, who I know has spoken to this audience before some years ago, and really invested in Dr. McRae and his team and all of the corollaries that spring from Dr. McRae, and that continues to yield dividend well beyond the time of recruitment. So although we only supported him initially for 5 years, the grant funds that he was able to obtain from national sources, the NIH, the VA, the DoD, and other sources, continued to grow in the first 9 years, yielding almost 20 million in funded grants. What does that mean? Funded grants really means new treatments, new ways to diagnose patients with TBI, new ways to monitor patients with TBI, and as a result, a better way to treat those patients and by extension, their families. Because of that work, we've been able to grow our research portfolio, the number of young, talented researchers that want to come to Milwaukee, as well as the clinical care that grows from it. As a result of that, folks like yourselves, who are philanthropically minded, have become engaged, including not just local resources in our community, but also national engagement, such as the Avalon Action Alliance, that program that is going to start next month, as well as several endowed chairs and endowed laboratory as well. So this is an illustration of what neurotrauma has done. So 7 years ago, as you can see in the bottom of the right side panel, in the year 2014, we started making the investment, and there's significant returns on that investment in terms of national grants that really permit the discovery of new biomarkers and other treatments for patients with neurotrauma. This funding of research has come from diverse sources. It's an index of recognition by the NCAA, by the NIH, by the VA, by the Department of Defense. Really, it's a vast number of national entities that have recognized the work that is going on here at Fredericton Medical College of Wisconsin and fund new neurotrauma research on our campuses. Like the Rotary, this rests on four corners of collaboration. What do? We really connect people. We take basic scientists, we recruit them, we connect them with brilliant clinicians that are working on the campuses of Fredericton Medical College of Wisconsin to enable the basic researchers come up with new ideas in which we can help patients with traumatic brain injury, and the clinicians are practically minded and they're able to translate those ideas and thoughts into ways that translate into better treatments for patients with traumatic brain injury. So the approach advances the science, first of all, advances the institutions, obviously, advances the scientists, but most importantly, the combination of those three things connect to advance patient care as well as outcome. The collaborations are at multiple layers inside a given department, inside a given unit of people that practice neurosurgery, for example, or neuroscience research. Interdepartmental, how do we connect neuroscientists with neurologists and neurosurgeons? National collaborations in terms of inviting collaborations with folks at other institutions, as well as community outreach and partnerships to deliver the best possible care for patients with traumatic brain injury and spinal cord injury. Essentially, we've all been aware of the old problem: injuries on the football field, injuries in other sports, in common walks of life. But really, we have a new awareness of what neurotrauma is. Dr. Bob Gleason spoke about the unseen injuries that veterans and first responders face, but this is a traumatic brain injury and spinal cord injury have vast implications in terms of the functionality of most people in society. So we have better science with these ideas in order to be able to get better treatments for these patients. We've come up with several alternative paradigms for neurotrauma research. We want to study acute brain and spinal cord injury in patients as the injury is evolving so we can intervene at the right times for the appropriate treatment for these patients. This has made us a center, really, nationally. We're one of the very few centers in the country that has almost 50 different clinical trials for a variety of, that try to tackle neurotrauma from a variety of different approaches. Do we intervene early? What types of imaging studies do we need to get to these patients? What type of regenerative treatments that we can get to these patients in terms of getting their functionality back to as close to normal as possible? So the index of a center's effectiveness really is demonstrated by the number of clinical trials we're able to offer, because clinical trials do really point to new treatments that we're able to offer patients. An example for spinal cord injury, at Fredericton Medical College of Wisconsin, 11 of the 12 major clinical trials worldwide have been done here since 2008. The only trial that was not able to be done was a trial where it had a competing indication with a different trial. So every single major clinical trial that's ever been done to regenerate the spinal cord has been done on these campuses. This is just an example of a young man that was injured several years ago, that after the injury did not have use of his hands, and he's able to shake hands and work on a computer after a stem cell transplantation. And we were only one of 6 sites in the country to be able to do this. This has really led to the establishment for the Center for Neurotrauma and the Center for Neurotrauma Research in the Wisconsin Institute of Neuroscience. And if I can use the pointer. So essentially, on the left side, you will see that it is really a collaboration between several basic science departments. This includes biomedical engineering, biomechanics, basic science, imaging, the Neuroscience Research Center, collaborating in a meaningful way with clinical departments. physicians that deliver care in neurocritical care, trauma and acute care, sports medicine, rehab outcome, and then collaborating with both regional community partners as well as national partners, including the NIH, the NINDS, the National Institute of Neurological Diseases and Stroke, the Department of Defense, the CDC, academic sponsors, industry sponsors, as well as philanthropy, in order to grow the corpus of research and clinical care for neurotrauma patients. The neurotrauma effort has gathered such momentum that recently the Marcus Institute of Brain Health, that was established by Bernie Marcus, as Benji Wagner recently shared. Bernie Marcus is the gentleman that founded one of the founders of Home Depot, and this program is intended to benefit veterans and first responders after their discharge from care at the VA or their healthcare entity, whichever that might be. It really recognizes that a lot of the injuries that the veterans and the first responders have are unseen. And it recognizes PTSD, dependence, and other issues, and really tries to set up an interdisciplinary program. So most of you would know that a patient with traumatic brain injury has potentially 6 or 7 appointments. They go to one appointment, they tell their story. They go to the next appointment, they tell their story again. They go to the third appointment. And so the serial nature of how our systems care for traumatic brain injury is not really effective for the patient. So what this concept does is it brings all the specialists together. So it brings the surgeon, the physician, the psychologist, the therapist all together in one place, and informs that team of the problems a particular patient is facing. It's voluntary. Patients sign up for this. But then when the patient comes to the facility, they have a series of appointments in the same day with all the necessary providers at the same time. So it's a completely different concept of how you think about rendering care for patients who've suffered from traumatic brain injury and have long-term signature effects of that injury. So if you notice, the first 5 places, Shepherd Center, which is in Atlanta, Tulane, Jefferson, Jacksonville, and Chapel Hill are all in the Southeast. We stand out at Frederick Medical College of Wisconsin. We are the only place in the Midwest that has been funded by this alliance. And we think that this is a recognition of our neurotrauma program at a national level, because the Avalon Action Alliance could have sought other partners in the Midwest, but they chose to seek Frederick Medical College to build this program. We're calling this program BRAVE, Building Resilience Through Action in Veterans and First Responders. And the gift is quite substantial. It's $12.5 million over 5 to 6 years, Center for Behavioral Healthcare for Veterans and First Responders for TBI. We're hoping to start this program on July 1 of this year and accrue patients and hopefully able to serve a number of our veterans, firefighters, as well as police and law enforcement through the benefits of this program. The intent of this program is to make it sustainable. The foundation funds the program for the first 5 years with the hope that our community will come together to realize the value of this program and support it for the long term after those 5 years have elapsed. The story, again, is it's about post-trauma wellness. It's a nonprofit helping veterans, first responders, and their families gain control over mental illness and brain injury issues. Like I said earlier, it's one collaborative resource, number of team members coming together under one roof to provide free care. By the way, there's no out-of-pocket cost for patients that sign up for this program, and really treats 3 interrelated post-trauma impacts: depression, PTSD, and traumatic brain injury and substance abuse. These symptoms and signs, as we talked about earlier, are signs of invisible wounds that are interrelated but difficult to diagnose. So really, this is a first of a kind and very, very important. And I know that the community of law enforcement, firefighters, and veterans are extremely excited to have this program here as a resource. And already we're beginning to get a number of calls of people who want to sign up for it. So I've just shared with you an overview of the neurotrauma program, what we did to start it, how we invested in it, how we were able to recruit the best in the country to come here and stay here, how we built around them, and then what that has resulted in a larger scale to bring neurotrauma care and new advances in neurotrauma care to Milwaukee and to southeastern Wisconsin. So how do we advance this concept more broadly into the neurosciences? So what are we going to do? So what I'm going to share with you is 3 things. first year's work, which has really been concept to foundation, and then three important things that follow that. Planning, what have we done in terms of how have we planned, and how are we going to launch it? Why are we unique? Naming, why did we pick the name? How did we study it? And then clinical trials, because clinical trials really are the fundamental entity that brings new treatments to patients in all of the neurosciences. Everyone here knows neurosciences is an evolving field. The discoveries of today are going to inform the cures of tomorrow in neurosciences, whether it be for memory disorders, whether it's for movement disorders, or other problems like stroke and so forth. I won't go into the other areas because I don't think time will permit that. So what is WINS going to look like? This is the structure of WINS on the left side. Wisconsin Institute of Neurosciences is going to rest on 6 key pillars. Those are neurotrauma, we've talked about that. We've talked about memory disorders, movement disorders, stroke, and neurovascular. And then 2 other things we have not talked about but are equally important in the neurosciences are epilepsy and people with brain tumors. So these are 6 key pillars on which we're going to build the Wisconsin Institute of Neuroscience. There are going to be a variety of other pillars as well, such as rehabilitation, device development for better neuroscience recovery and care with biomedical engineering, comprehensive pain, headache, spine care, spasticity, neuropsychiatry. Behavioral medicine is a big part of the neurosciences. Multiple sclerosis, and then imaging. Imaging is really a very important surrogate that informs physicians and teams about how to care for patients with neurological problems. Each of these pillars is going to have a fundamental structure. The recognition of the fact that basic research is really absolutely critical to inform how we design, how we create clinical trials, which in turn informs clinical care and then attracts the best and the brightest from the country so that they get their education and training right here in Milwaukee. So I like to think of this as a positive feedback loop. Innovative, important, new findings in basic research would inform the generation, design, and implementation of new clinical trials, which then renders us able to give the best clinical care to our patients, also patients from outside of Wisconsin, and then attract the best and the brightest, hopefully to retain a lot of them right here in Wisconsin. The power of collaboration. It's very, very important that the Neuroscience Institute has a very strong neuroscience research center as its partner. Dr. Hillard, who's the director of the Neuroscience Research Center, is here as a guest today. Basic research of today really funds and gives us a path to the clinical treatments of tomorrow. You all know that this concept is true in cancer, it's true in cardiovascular medicine, it is no different in neurosciences. Extremely important to foster and grow basic research so that tomorrow's cures can be brought forth. And then the combination of this basic research and the clinical care that we're able to render, we feel is going to get us into the national top 10. So we did a gap analysis in order to plan it. We looked at what's the best that exists out there. We actually visited the Cleveland Clinic, more importantly, to figure out how we can do things better than the Cleveland Clinic, because I think we can. We also did an internal assessment to look at what we have in comparison to the best that's out there, and did a gap assessment. What are the things that we need to focus on, and what order we need to focus on them so that we can build a world-class neurosciences institute here. So what will WINS be? It will be what's in the center, exceptional patient care and performance across service lines and wherever the patients go to seek care for their neurological problems. But that's really going to happen with 4 different approaches: facilitating translational care resulting from clinical research and trials, communication. We're going to share our information and findings with one another, basic scientists with clinicians, clinicians here with clinicians elsewhere, the collaborators, partner to develop growth plans, clinical care pathways, and a destination. We're going to become a destination for neuroscientific education and training, which I think we really ought to redefine going forward. So this is an interesting slide because as part of this exercise, we looked at the 10 best adult neurosciences institutes nationally. That's on the left side. The 10 best pediatric neurosciences institutes are on the right side. What you'll notice when you look at this is that there is no overlap. There's not a single institution in the country that does both world-class or nationally ranked adult and pediatric care. When I go on our campuses, I notice that the Children's Medical College of Wisconsin and Frederick Hospital, Frederick Health are all interconnected with sky bridges and tunnels. So we're the only campus in the country that has the capability to offer lifespan neurological care, both pediatric and adult. So that's going to be unique about WINS. We're going to be better together because we're able to provide integrated neuroscience patient care across a patient's lifespan for them and their families. Will be a hub. It'll be easier and more economical to be a hub for novel clinical trials because a lot of the resources for clinical trials are really shared. Because of the Medical College of Wisconsin, we'll be able to integrate cutting-edge research that will inform the future of both adult and pediatric neurological care, and we'll redefine education. Education traditionally has been thought of in the medical field as physicians, APPs, and other trainees, fellows and residents, and so forth. But I think we should open it up. We should, the betterment of a patient with a neurological problem includes a whole team that includes the physician, the trainee, the physical therapist, the occupational therapist, researchers. So really redefining education is going to be really important. And we feel that our reputation and growth in national ranking will attract a number of patients, most importantly, those that are here, but also those from beyond our state's borders. So our goals are to achieve exceptional patient care by growing each of the pillars that I shared with you earlier, maintain our eye on quality, and improve access to new patients so that whether they're from here, whether they're from faraway places, they can get care in a timely manner. We really want to focus on clinical trials to be the first in Wisconsin, first in the Midwest, and top 10 by 2030. We have to grow the clinical trials, and I'll share a little bit about that in a second. We want to build research programs funded by the NIH, not just in neurotrauma, which we've already succeeded, but use that knowledge from neurotrauma to broaden our reach into the other areas of neurosciences. We want to offer lifespan neurological care by developing appropriate care pathways in a variety of neuroscience disciplines and really redefine neuroscience education by increasing educational offerings. I would love to see a day when a young, bright medical student or a researcher wants to go get their training at WINS because they've heard so much about it. That's our goal for the long-term future. Why is a name important? Just we did a study of the national consumer database population, essentially to make sure that WINS would stand as a place that could be recognized. This consumer testing process was administered to both consumers as well as physicians. Happily, it inspired the greatest degree of confidence among all the names tested, this and other names, in both consumers and physicians. It was highly appealing to consumers. We're happy we got these results because especially the younger population, they found it even more appealing. Referring physicians also found it appealing. So, and the name WINS was able to transmit the right things: neurologic disease research, highly trained doctors, major hub for research. It was clear, suitable, and engendered trustworthiness. Finally, a few words about the Clinical Trials Office, because I think that this is extremely important that we grow our clinical trials platform to be nationally competitive and also to serve our patients better. We appointed Dr. Mike McRae as the director of the Clinical Trials Office. He's got a whole team assembled. We're going to be working with a variety of neurological disorders: multiple sclerosis, movement disorders, neurotrauma, spine, rehab, stroke, headache, epilepsy, neuro-oncology, memory, and psychiatry. So he's got a broad array of disorders in which he's going to have to grow the clinical trials platform. He's actively engaged in that. Currently engaged in coalition building, ground-up approach to engage everyone, assess our internal landscape, and then look at what we can do to offer more and better trials than our competitors in the Midwest and beyond. If I'm invited to come back and share our progress with you in a year or two, this is what I'm going to be able to hopefully share with you to show that Frederick Medical College of Wisconsin really leads in the area of neuroscience clinical trials across the country. So I think that will really put our mark in terms of being able to offer answers to patients with currently incurable neurological problems. So how do we go to the top tier? Key partnerships, which I hope I've illustrated. We use a pathway that we've already proven works, which is in neurotrauma. We've done our due diligence with the key pillars of neurosciences, key programs, and the uniqueness that WINS offers to our patients, to our trainees, as well as our researchers and core faculty. Is grounded in our experience. It's deliverable. Again, based on the example of neurotrauma that I've shared with you, and the design is based on real data in Wisconsin. We think we're able to deliver it, and obviously this is going to have a multi-dimensional return on investment because it'll have a halo effect on a variety of other missions as well. fundamentally to help our community. So I think I'll stop there. I was asked to stop at about 20 to 25 minutes to see if we can have some interactive conversations, which I'm hoping we will, because I'm hoping this will have raised a lot of questions in all of you.
If you have a question for Dr. Kurpad, you can do so using this microphone here.
So thank you, doctor. Just getting down to the nitty gritty, if I've got a loved one or someone I know that needs to get into one of these trials, how do you do that? How do they get from my house to your house?
Well, absolutely. I think that's a very important question about how we're going to deliver a new treatment that's offered in a clinical trial. So most clinical trials are published on standard sites like clinicaltrials.gov. Will be part of that, obviously. But we'll also, as we grow the number of clinical trials, especially because neuroscience is a diverse number of disorders. It's not like cancer, essentially, because there's some people who have MS, others that may have a completely different problem like stroke. So it's a diverse family of disorders. So as and when we accrue clinical trials, one of the things I did not talk about is our media office. So we're going to use that as a portal to inform our community of new trials as and when they become available. So hopefully through a multi-pronged approach, through the media office, through standard portals, that people can get informed about clinical trials, will be able to inform the community as well.
Thank you very much for your presentation. I was really impressed with your business strategy from your core areas of focus, including the folks who protect us on a daily basis, and the synergy between the college and children's in terms of an area of excellence. I have the blessing and curse of living my professional life in Madison, having come from Milwaukee, so I'm not unmindful of the rivalries between the two cities. And if you Google neuroscience at the UW-Madison, they claim 90 researchers. And of course, they have the Weissman Center and others. Can you speak to the issue of competition, cooperation, or neutral between Madison and Milwaukee on this issue?
So another really excellent question. Obviously, we want to be collaborative with our sister academic institution in the state. I see a tremendous amount of synergy in our research efforts, because research is really a community effort. When I say community, I mean patients with neurological disease. So really the research findings that come out of Madison, and for that matter, other places beyond Madison, will be critical to inform what we can do in terms of delivering the right clinical trials and the right clinical care. Complementary pathway is also true. They would benefit from the work that comes out from our institution. So there's a very collaborative approach. We actually have joint conferences together even now every month. But I also think that there's some unique needs in our community versus those in Madison. So I think there's some areas of neuroscience like stroke and neurovascular that a patient, for example, with that condition doesn't really have the time to go to Madison. We want to have the best not only in the region, but hopefully in the country right here in Wisconsin, right here in Milwaukee, I mean. So I think there are certainly synergies, and the intent is not to necessarily compete, but grow the body of basic science research together, and then be able to offer clinical trials that are unique, so we can be a resource for each other.
Thank you very much.
Sure.
For your presentation. I have a question. While this it's wonderful. I come from a family that has multiple physicians. At the end of the day, this is going to be expensive health care. So considering the population and the reimbursement sometimes from government for health care and for physicians, we have hospitals right now in Milwaukee that are closing down different services and sections because staffing and because of reimbursement rates. So you can have a lot of these wonderful things, but how are you going to guarantee that the reimbursement is going to cover so that it's going to remain sustainable?
I think that's another really important question that we've reflected on a lot, and will probably require continued reflection to make it sustainable. I think it's it's new treatments, research, and generating clinical trials and deploying them all cost money, and so we really need to be aware of how we are able to reach as broad a population as we can, which render equitable care across our community. I think one of the things that I shared in terms of this positive cycle, basic research that informs clinical trials, which in turn informs high level clinical care or effective clinical care, and then teaching, it rests on the support of the community. It really, as healthcare moves forward, neuroscience is no exception. I think there's going to be a lot of increasing dependence on the efforts of the community to make these services able to be provided to a large part of our population, all of our population. The Avalon Action Alliance is an example of that. It's an example of a national institution, a nonprofit, that really recognizes a gap, in veterans and first responder care, and is able to provide resources so that we can bridge that gap. So ordinarily, those individuals would be lost to future treatment. Ordinarily, they would be discharged from the VA, or they'd be discharged from wherever the particular first responder has their health care, and they'd have no resources to access to be able to get better from ongoing PTSD issues. So this is an example of being able to partner with a foundation or other entity that could sponsor a particular type of care that's important. So I think, I don't think that that's a be-all solution for everything, but I think efforts like that are going to be really important. And from an institute perspective, we will hope to be staying engaged with raising those resources as and when needed. So that's, to me, is the long-term way to create sustainability. Yes.
Hi, thank you for coming. I have a similar question. I work for a not-for-profit that tried to have a step-down care for people with traumatic brain injury. And it's a very difficult operation to have, very difficult to get funding. Are you working with people on partnering for step-down care for people who have traumatic brain injury as part of your lifelong care plans?
Yes, so you're referring to patients who have left a hospital setting, but they're
Right,
sort of not quite
Right, the funds ran out for staying in the hospital.
right. So again, it's not necessarily a problem that you'd have a simple solution to, but I think it's really, we have at Freighted Health, for example, we have a rehab hospital, which is really geared towards better care for patients with TBI and spinal cord injury. But again, there's many other institutions like that in Milwaukee. But I think to be able to deliver the right kind of care in an equitable way, we will need investments by the community as well.
Thank you for joining us today. Wondering if you could describe to us your thoughts with respect to the partnership with the Veterans Administration and also veterans groups like the Paralyzed Vets of America.
Thank you. So the PVA and its local chapters have been big supporters of our basic research in spinal cord injury that we do on our campuses at Freighted and MCW. They've also been very, very important to help with clinical trials and other efforts. Especially, spinal cord injury is not as common as traumatic brain injury, for example. So therefore, a lot of the clinical trials don't necessarily go the full extent because funding dries out and it doesn't work out. So there are some medicines or drugs, we call them orphan drugs, that have been used for other diseases that have passed the FDA approval, that have found a use in patients with spinal cord injury. And the PVA has been very, very helpful in terms of being able to help us operational, not just us, but Madison, other places as well. So I think from partnering with the veterans organizations, which is what your question was, I think the Avalon Action Alliance gift would be really that, and other organizations like the PVA would be really. There's another local foundation called the Brian Reach Paralysis Foundation that does a lot for spinal cord injury research. So one of the ways I see the interconnectedness of that is the community, the level of community engagement that can spur. So I think we are hoping to engage. For example, there's a group of submarine veterans. There's VFW, areas that or entities around our communities that some of which are interested in becoming engaged. So what we would like to do is really broadly engage the community, the veterans community, as well as other organizations, in order to grow this effort. Jackie.
Hello. I have no doubt you're building an outstanding program here. I'm curious as to how you see the whole institute reaching out around the state, such that if I'm in Stevens Point, Wisconsin, I can see my physician there, have all the benefits you have, come down here to get treatment, go back. So I'm interested in the clinical pathway network as well as patients, such that wherever you are in the state of Wisconsin, you truly have access to all the work you're doing.
So this is a really, really good question. So we want to be able to reach the patients where they are. That's really a fundamental importance. Our traditional models have relied on patients with Parkinson's disease or memory disorders coming to a big building in Milwaukee and then navigating things that I can't navigate in order to see their provider. So, that's been the traditional model, not just here, but all over the country. That's the healthcare model. And Eric Conley will attest to this. We've been engaged in, how do we transform how we approach delivering care? And I think a lot of the care delivery needs to be rethought. If it's a patient with a movement disorder or memory disorder, for example, but they can't come easily, how do we get to them in a way that, and I think the WINS name would be easily recognizable. So I think it would be easy to say, here's your care is coming from a provider from WINS, but then we're not really all sitting in one place, but we're really virtual, if you will. We're disseminated from a clinical care delivery perspective. Clinical trials are not always stem cells. They're not always the new expensive drug. It could represent a method of care, a different paradigm, a different pathway. That is also a clinical trial. It's a way of doing something different than we currently do it. That could be more effective at reaching a larger group of people in a way that would help them. So I think thinking about the delivery of care completely differently would be really, really important, and that will be an important part of every pillar that we would do. The thing I didn't mention, Jackie, is that each pillar, I understand a little bit about neuroscience, but I'm no expert in the details of each pillar. So one of the strategies we're gonna roll out is we're gonna engage a beacon leader, whatever their background might be, for each of those pillars, who understands multiple sclerosis better than anyone else. And those individuals are going to be, we hope, full of ideas on how to transform care and how to deliver care in a way that it makes sense to patients, how to come up with new care pathways and so forth. Hopefully that answers the question. Thank you.
What mechanisms will you have in place to commercialize the intellectual property that comes from the research?
I'm so glad you asked that question. Thank you for asking it. So innovation has a large number of beneficial effects, right? And so we don't have a formalized mechanism yet in terms of a pathway where an innovator who's part of WINS can say, here's your 4 steps to get to commercialize your new pathway or device or other invention. We have a resource within the Medical College of Wisconsin, but I do feel that needs to be expanded significantly so that the throughput can be, the researcher, we want to have the researcher or the device developer doing just that and not worry about a lot of the other details that they need to. So we need to create a pathway for them. And so we're working actively on creating something that is easy and able to be implemented. But it's a very important question. We do that at a departmental level, for our trainees right now. Neurosurgery, as an example, is, a trainee or an apprentice is required to go through clinical training in terms of how to make a clinical decision, how to make a surgical decision, how to do an operation, and so forth. But what I've always felt over the last 15, 20 years with my own training is that we're never taught how to take an idea and then translate that into a better device. And so very few people have that idea and are able to do it, but they do it on their own steam. We don't have a formal way of teaching residents. So one of the things we've done in the neurosurgery space is to create an environment where we give trainees some exposure to commercialization and so forth. So likely we'd like to do it broadly across the neurosciences. Thank you.